Hello and welcome. I'm Sam Califer, your host for Vision, the show where we talk all about the College of Arts and Sciences as well as its faculty and students. Today I'm joined by Dr. Mary Dozier, an assistant professor in the Department of Psychology. Her work focuses on the assessment and treatment of hoarding disorder in older adults. Thanks so much for being here.
Thank you so much for having me. I'm excited to be here.
Yes, I'm glad to have you on, excited to talk about all of your great work. But first, I would like you to introduce yourself, talk about your professional background and how you came to Mississippi State.
So I'm from Texas originally, so I'm used to the heat. The humidity is still taking some adjusting. I did my undergrad at Rice University in Houston, which I thought was humid, and then I moved to Starkville. And then I did my graduate work out in San Diego at the San Diego State University, University of California, San Diego Joint Doctoral Program in Clinical Psychology. So I've been at Mississippi State for about 3 years now, and I am almost used to the humidity and loving the falls and springs. Can't wait for daffodil season. And I think you wanted my actual professional background. So I've been working on different studies for hoarding disorder for, I guess, the past 8 years or so. So in San Diego, I worked a lot on a study looking at cognitive rehabilitation for hoarding specifically. And now I'm focusing more on motivational techniques to help people declutter.
Yes, we're so glad to have you here at Mississippi State. Your research is so interesting, and it's all about hoarding disorder. And maybe people have a slight familiarity with it, but for people who don't know, really, what exactly is hoarding disorder and how did you come to focus on it in your research?
It's a great question. So hoarding is a psychological phenomenon just like anxiety or depression. So just like those concepts, it's on a continuum. So from everything from people who are minimalist, like, the woman who's all about, does this thing bring you joy, Marie Kondo, to people who have so much clutter that they're no longer able to use the rooms in their homes for their intended function. And that's the corner where we tend to talk about hoarding disorder. So people with hoarding disorder as a psychological diagnosis have excessive clutter, but also they have cognitions around their items. So by that I mean strong urges to save items, so things that maybe you or I wouldn't necessarily want to save, and also more difficulty with discarding. And sometimes it's due to difficulties with making decisions about things of, do I need to keep this pen or not? And sometimes it's around attachment to items. So whereas I might think, oh, this is just a pen that my mom gave me one time, I can toss it away, somebody with hoarding disorder might be more likely to say, this pen was given to me by my mom. If I get rid of it, it feels more like I'm getting rid of my mom. Just a really long way to explain hoarding. But in terms of how I got into it, I've always been interested in helping older adults. That working with older adults I find to be especially rewarding, just because you'll have people that have had a psychological condition for years or decades even, that in a few short weeks of typically 8 to 16 sessions is where psychotherapy is, you can have people whose lives are completely changed. So with those kind of two interests of working with older adults, and then the interest I didn't mention was anxiety, I found myself in geriatric hoarding. So with older adults who over the course of their lives have found themselves in a place where they have so much clutter that they're not able to really live the life they would like to live.
Yes, that's so interesting. I think people might have an idea of what hoarding looks like, but you're really getting into the mentality and the thought process behind it. So that's so interesting. And you've been busy. A lot of research. You've published several articles already this year. They focus on things like cognitive rehabilitation, like you said, and as well as object attachment with aging. So that is all just so interesting, and I was hoping you could go a little bit more into detail about some of this recent work that you've done.
Yeah, so the cognitive rehabilitation project was with my mentor back at UCSD, so Dr. Catherine Ayers, and she's found that using cognitive remediation or cognitive rehabilitation, which is basically teaching people skills to work around cognitive deficits. So we tend to use it with people with traumatic brain injury or schizophrenia that might, say, have problems with planning or organizing or problem solving, and we give them very concrete skills to help them work around those deficits. So we found that if we can teach people some of those skills, that it can help with some of the decisional problems and disorganization that goes along with hoarding. And that's an intervention that she's found to be pretty effective with older adults with hoarding disorder. So about a 6-month dose of treatment will get a 40% decline in clutter. And the question that I've had for my work here is how we can get that 6-month dose of treatment into a shorter time span, which is why one of the things that I've been targeting is motivation.
Sure. Well, that's so great to hear the positive outcomes from your research. You're staying busy, and now you're trying to recruit participants for a new study. It's called Project Reclaim, Reduce Clutter and Increase Meaning in Your Life. So what is that project about, and who are you looking to recruit?
Thank you. Yeah, so I got funding from the American Psychological Foundation to do a pilot study of a 6-week-long intervention where we use motivational interviewing to help people really think about in essence, whether or not they want to keep on with their current patterns of keeping things, or if there's changes that they could make to their life to help decrease the clutter. So one of the things we found is that people with hoarding disorder might have a disconnect between understanding how their behaviors lead to the clutter, but they don't necessarily like the clutter. And so my hope is that we can help to bridge that divide through Project Reclaim. So I love a good acronym, and when thinking about a project where we're going to add, help people to really increase their motivation, and with that meaning, I was happy that I, through a lot of brainstorming, came up with Reclaim. We're wanting people to be able to reclaim their home. But the project itself is with older adults, so defining that as people age 60 and older, living within a 1-hour driving distance of Starkville. So all of the treatment will actually happen in the home. So it's the idea there is it makes it more accessible for folks. And I know that we're still in a pandemic, so everyone who's on the study staff, so myself included, and our clinicians are all vaccinated. So our hope is that that makes it easier for people to feel comfortable letting us into their home.
That's great, and it's so fascinating to hear and positive, I think, that you're bringing all of your expertise here to Starkville and trying to make a positive impact with the surrounding community. So that's fascinating. And one thought that I had, it could be difficult, I would imagine, to find participants for your kind of work, either because people don't want to talk about it or they might not even know what it is. So I was hoping you could speak to these points. Does hoarding always look like what you see on TV? And do you find that there's a lot of shame associated with the disorder?
I really like that you brought up this point. So I think the television shows have done a great job of making more people aware of hoarding while also simultaneously doing a great job of stigmatizing it. So people watch that show and they think, oh, that's those people. Or in truth, hoarding is something that it's a behavior, right? That over the pandemic, we found that people hoarded toilet paper, right? It's just for some folks, they have that behavior around more objects, or just that it's harder to get rid of things. So actually for this study, one of the things that we've been doing is trying to open it up to people with more of a range of clutter, of just older adults that have more clutter than they would like. So whether or not they meet the strict diagnostic criteria for hoarding disorder, if it's just somebody who is sitting at home and thinking, I have so much clutter, I'm not able to make that yoga studio in my second bedroom that I would like. Or I really want to get into baking bread, but there's so many things cluttering up my kitchen that I just can't seem to be able to move around it. Or the one that I hear most often, which is people saying that, once the pandemic really starts to lift up, I want to have friends over for a big party, right? A dinner party even, and feeling like you don't have enough space in your home to be able to do those things. So I think the stigma is such a barrier to treatment, and my hope, in part by doing stuff like this, is that people can see my face and see that I am not a scary person to invite into their home.
Great, and I'm glad you're bringing attention to it, trying to destigmatize it. I think in the past, it's something that a lot of psychological disorders maybe has seen, but in the recent years, people are more open to talking about things like depression and anxiety. So it's good to see that you're doing that same work with hoarding. And so just to end, you're an expert in this field. What are some insights and best practices that you found to really help people overcome their hoarding behavior?
I think just really being thoughtful about what you want out of your home and what you want out of your life, and thinking about, is the object you're looking at in front of you, is that Is it value consistent for you? Is it having that object making you closer to your goals, or is it keeping you from achieving your goals? And sometimes the answer is yes, you want to keep that pin. And sometimes the answer is, I have 12,000 pins and this one doesn't even work. I can let this one go.
That's great. Well, thank you so much for joining today, Dr. Dozier, and thank you all for tuning in to this episode of Vision. We'll see you next time.